Good evening, everyone. Good evening. Good evening. Before we jump in, I just want to say thank you for showing up. I know it takes courage to be in this space, whether you're here for yourself or someone you love. It definitely means something. My name is Janae Blackwell, and I'm a part of this beautiful sisterhood called My Sister's Keeper. If you're unfamiliar, My Sister's Keeper is a female-led nonprofit dedicated to surrounding women undergoing cancer treatment with a supportive community. We walk alongside women through every step of their cancer journey, whether it's physically, emotionally, spiritually, by offering access to wellness services, peer support, educational tools, and personalized care. Our community was founded by warriors for warriors. So tonight we began something very special. It's a new series called I Have Cancer, Now What? And it was born from real conversations that we've had with our sisters who shared that after they heard the words, you have cancer, they were left with more questions than answers. This series was designed to meet women right there in that first foggy, overwhelming stage and walk with them step by step, not just with facts, but with feeling, and not just with charts and data, but with community. So over the next few weeks, we'll explore everything from diagnosis and staging to different types of treatment, holistic support, mental health, intimacy, finances, and more. Each session will feature experts, fellow warriors, and voices from our own sisterhood to help bring light, clarity, and comfort during some of the darkest moments. However, before we get started, I do want to give a little disclaimer. This evening, I'll be role playing as someone newly diagnosed with breast cancer. And while this is not my personal reality, I've held the hands of many women in that exact moment. I'll be drawn from their stories, their emotions, and their fears to help spark honest questions and get the answers we all need. I want us to treat this space like we're in a living room. We're just a group of sisters talking, sharing, asking, encouraging. You're welcome to jump in through the chat, the comments, or come off mute and share what's on your heart. So, without further ado, and action. Cancer. I have cancer. I have cancer. I don't know how to feel. My stomach's in knots. My head's spinning. Am I scared? Am I work? I don't know. I don't know. But that's why I called you ladies here today, because I don't know. I mean, I heard them say, I have cancer, but now what? Sherry, thank you so much for coming today. I know I called you earlier, just totally out of it. Thank you so much for coming. I wanted you to come because I know you've been through it, and I just really needed someone who gets it, who can help me through this. Thank you, Sherry.
It's okay, Janae. I got your back, girl. I'm here for you. Well, I think it's good to kind of step back and let me tell you how I found my cancer. I was 32, no family history, and I was too young to get mammograms. And I wasn't even doing the regular breast exam checks, because I was too young to even do it. So, but one day I just felt like something was just poking me in my chest, like right here. It just felt like somebody was just poking me all that time. And then I felt it and it was a lump. And so I went to the hospital, saw my primary care physician. They did some biopsies, and then they found cancer from there. But to help support you in this aspect, I wanted to bring along one of my greatest friends, an amazing person who has a family history of cancer and also is one of the predominant or infamous medical oncologist in Cleveland, Dr. Tiffany Unger, and I wanted her to come here to kind of help walk with you along this path. Dr. Unger, you want to tell your story?
Yes, thank you so much for just having an opportunity to be here. Being able to speak with somebody when they're first diagnosed is truly an honor and a privilege. Um, Going through cancer, just the cancer experience can sometimes feel very scary, um, and sometimes can also feel isolating. Sometimes it can feel very private, especially as you're just getting that diagnosis and trying to figure out which way is up. Am I going to be here, to make it to Christmas? I mean, these are very real concerns that people share with me and that I shared with my mom when she was diagnosed. My mom was diagnosed actually late. She was supposed to get her mammogram when she initially felt a lump, and she was basically dismissed by the healthcare organization. She lives out of state and had gone to the premier academic center there, and they told her, this is nothing. That don't worry about this. This is a cyst. And then later she came back and said, I have a lump under my arm too now. And they were like, well, that's just because you get your nails done. And so she went more time still undiagnosed. Um, and it's because of the experience that she had that really inspired me to want to speak about breast cancer, become a medical oncologist, to help other women. Um, she went through radiation, chemotherapy, bilateral mastectomy. She did as much of the chemo as she could. Um, and then she said, this is it. I'm giving it to God. I can't do more. And thankfully, we're a spiritual family. Thankfully, by the grace of God, she is doing well today. Um, but she and I, and really our whole family, continue to be strong advocates for, if there's something going on in your body, you got to talk to somebody about it until you figure out what is going on. It's not something that should be poo pooed. When I talk to people, I say, hey, if there's something abnormal going on for 2 weeks or more, it must be brought to a healthcare providers, and you do not stop until you know what it is. So thank you so much for allowing me to be here as we, talk about breast cancer and what we can all do to support each other as we're, if we know someone who's going through this.
Thank you so much for being here, Dr. Unger. I mean, of course, I'm overwhelmed, but it's amazing that, I have someone like Sherry who can actually bring a doctor here to speak with me today. Um, I actually have some other sisters on the way. I think they're coming through the door right now. Ladies, have a seat. Have a seat. We were just talking about, you all know I just got diagnosed today. That's why I called you all over. Any of the ladies, would you mind, letting me know what some of your symptoms were, if you had any?
Someone on Facebook responded, leakage.
Leak. I didn't have leakage. I didn't. Hmm. Anyone else? What did you go through?
And for me, I didn't, other than the lump that I knew was there, I had nothing, no other side effects. And it was just bothering me mentally because I knew something was extra added that gave me that extra anxiety, but I had no other symptoms, no pain, just the lump.
So, Dr. Unger, what does my diagnosis actually mean, like in terms of staging and prognosis?
That's a very important question that you'll talk to your doctor about. One of the things that you'll discuss when you first meet with your oncologist, and usually it's actually whoever you meet with first, sometimes it's a medical oncologist, sometimes a surgeon, but they'll review the pathology report. And just as a reminder, that pathology report was the report issued by the pathologist. The pathologist is the doctor whose job is to look at those cells underneath the microscope and identify where those cells came from. And so in the breast, there's a lot of different tissues, and their job is to find out, is this normal? Is this normal breast cells? Are these cancer cells? Are they cancer cells from the liver, from the bone, from the breast, or anywhere else? And then they do additional testing to look for something called receptors to help guide the treatment. The stage is based upon the information from those receptors, but also the size of the mass, if there's any evidence of spread to the lymph node, and if there's any spread to other parts of the body. And so, in addition to the mammogram and the ultrasound, sometimes the MRI that you might have already had or might be in the works, sometimes your doctor will talk to you about getting additional pictures, sometimes a PET scan, sometimes a CAT scan, and that's to determine if the cancer has gone to another part of the body, like the lungs or the liver or the bones. So the stage is a description of how far the cancer has spread. Stages are 1, 2, 3, and 4. Stage 1 is the most limited, and then stage 4 means that it has gone to a distant body part like the lungs or the liver or the bones. And we consider stages 1 through 3 curative. And so the team will talk to you about what's the right approach based upon the stage.
Thank you so much. What about risk factors?
That's a great question. A lot of people, when they come to my office, they'll say, what are the risk factors for breast cancer? Like, why did this happen to me? And there can be a number of different risk factors. They can be modifiable or non-modifiable. I like to sometimes show a picture because sometimes that can just help kind of clarify that. So some of the modifiable risk factors are things that we're actually in control of. So we know that having a higher weight, being physically inactive, even drinking alcohol, which a lot of us, we do enjoy from time to time. Even as an oncologist, I enjoy alcohol from time to time, but now that I'm more aware, I can make decisions that are in line with my goals. So maybe, you know, if I used to drink more casually, I might save that for more special occasions, for example. But there's also non-modifiable risk factors like family history. These are the cards that you were just dealt. Having an older age and having dense breasts. Um, there's not a lot that we can do to impact those non-modifiable risk factors, but they're still important to know about. And a lot of people, we don't know what that particular one thing was. Um, and so that's why I like to kind of think about what are the things that we can actually, interact upon. So that's the keeping our weight under control, exercising, even just 30 minutes a day of walking is still enough to lower the risk factor. And even though you've been diagnosed, I don't want you to feel like, okay, well, let me just, fall into a tub of ice cream. Even exercising now at the point where you're diagnosed today can still help you going forward, can still help you do better throughout treatment. So you know, don't despair. Don't feel like there's nothing that you can do to help yourself. Um, there definitely are things that you can do to help yourself. And then, of course, limiting the alcohol.
Sherry, what about you? Did you have any risk factors or family history when you were diagnosed?
Yeah, so for me, I have no family history whatsoever. And so when I told my family about it, they was like, "What? Cancer? What are you talking about? Nobody had that." So no family history at all. But now I've created that history for my family. So, I have my twin daughters. They're about to be 20. And because I got cancer at 32, they have to start screening at 22. So they're very anxious and worried and scared because I've created that history now for them.
I'm so glad that you're mentioned that part about family history because a lot of times when we are talking to our doctors, like we're often thinking just about that particular cancer, just about breast cancer. But when it comes to a family history, you actually want to know about any cancers in your family. So as a cancer doctor, I'll start our conversation about the family history asking first about the parents. If there have been any cancers that have been diagnosed in mom or dad, then I move to the siblings, aunts and uncles, grandparents, and then we can move a little bit more remote, like the cousins. And the reason why I ask about any cancers is because the there are genes that can increase the risk for breast cancer, but those same genes can also increase the risk for other cancers. So, for example, a BRCA gene mutation um, that can increase your risk for breast cancer, but can also increase the risk for ovarian cancer. It can also increase the risk for breast cancer in men and prostate cancer in men. So that's why I ask about all cancers when I'm talking to my family. So that might be something that would be helpful for your doctor when you have your appointment.
So how might my family history or genetic testing results impact my specific treatment plan?
It can impact it in a couple of important ways. The first way that it can impact it is it can help guide sometimes a surgical decision. So, for example, if you have a genetic mutation that increases your risk for breast cancer, the surgeon, instead of offering to do surgery on just the breast that has the cancer, they might offer to do a preventative surgery on the other side. We call this a prophylactic mastectomy. Prophylactic means that it's in the preventative space. It can also help guide decisions for or screening for future cancers within yourself. For example, if you have a BRCA mutation, then they'll have you meet with somebody to look out for ovarian cancer or even talk to you about having the ovaries removed as well. So it really helps us understand what the other risks are for cancer so that we're really treating you comprehensively instead of just the breast cancer that's on the table right now. It can also open up other medicine treatments. So sometimes we use chemotherapy in breast cancers, but there are certain treatments that are available only to people who have a genetic mutation. And so you don't want to miss the opportunity to be considered for the other treatment if we don't know about the genetic testing results. And so that family history will help kind of guide which genes are looked for at the genetic meeting. And then finally, it can help influence conversations for your other family members, particularly if you have children. And so I'll have some people who say, um, I'm not as concerned about myself, but my daughter or even my sons, um, I want to know for their benefit. So there could actually be a lot of different implications to the finding out the results of the genetic testing.
What should I even bring to my appointments or ask during my appointments to make sure that I'm making the most out of our time with my doctor?
I will tell you what I brought to my appointment with somebody else. You're going through so much right now. You may not be in a point where you can accept or retain what is said to you. So having someone there who can help take those notes, ask those questions with a clear state of mind, because it's okay when your mind is not clear and it's foggy because you've been told something that is just life altering, I'm not going to say life threatening, but it is definitely life altering. So definitely bring someone else with you to be able to take that in. That was the only thing that I brung. So my sister Demetria, me and her fight all the time, but she was there. She was at my appointments taking those notes and asking those questions that I didn't even know I needed to ask.
I think that's one of the most important things that you can bring to the appointment is another person because there can be a lot of information that is shared at that first appointment, and a lot of patients do tell me it can be completely overwhelming. They're appreciative that they're meeting everybody on the care team on the same day, as much as possible, but it can be absolutely overwhelming. So having another person there to help take notes, to even help ask questions, sometimes you might not even know what questions to ask, but your family member, your friend is going to help you um, be able to ask questions or say, hey, I noticed that we didn't talk about this. Should we talk about this? Or they can even ask you, hey, Janae, I noticed that we didn't bring up exercise. Should we ask the doctor if that's something that is safe to do right now? Um, and so they could just be really helpful from that standpoint as well. And then even if you can't have somebody, physically with you, because I get it, people are busy. Sometimes there's a lot going on. Sometimes you're trying to have, somebody watch the kids. Even just ask, like, if you can have somebody on the phone, or asking if the conversation can be recorded is perfectly fine. I encourage my patients. Matter of fact, when I come in, I like to ask them, I say, is there anybody else who should be, involved in today's conversation that might want to be on the phone while we talk about what the plan is for today? And that way they can hear really directly from the doctor about what the treatment plan is. 'Cause sometimes when you go home, it's just like, I don't know, I just need to have surgery. And, your family's going to want to have more details than that. So sometimes having an extra person, an extra set of ears can be really helpful.
So what are my treatment options?
So that is a important part of the conversation, especially at those first visits. So what I anticipate you'll probably meet during that first visit is with the multidisciplinary care team. And I don't know, Sherry, do you recall meeting with your multidisciplinary care team early on, or was that something that was brought on a little bit later?
Actually, it was kind of all over. Sorry, I'm not gonna say. I didn't mean to say that. It was it was brought on later, but it was gradual. But uh, I do remember telling my PC. Well, one of the things that my oncologist said to me, Sherry, I'm going to treat your cancer, but anything else that is not related to your cancer, you have to see your primary care physician. And I remember that confusing me so much because anything that I feel after being diagnosed with cancer, I'm going to attribute to being cancer. So how do I know what's not and what's not? So that was the one confusing part for me. But we settled it.
Yeah, I can certainly appreciate that. So I'm going to break down kind of what some of the people, Janae, you might meet. So you'll probably meet, usually they try to have you meet most of the team within the first 2 weeks. You'll probably meet with a medical oncologist, so that's my role. The medical oncologist is going to talk to you about systemic therapy, or you can just kind of think about it as medicines. The surgeon, of course, is going to talk to you about surgery, and that's going to be more localized, specifically to the breast and or lymph node area. And then similar to the radiation oncologist, so, that's going to be a local therapy as well. So kind of the three main doctors that you'll be interacting with are going to be the medical oncologist, the surgeon, and the radiation doctor. The surgeon's probably going to talk to you about the two different options. Usually it's going to be a lumpectomy, where they just take out the area of the cancer and some normal tissue around it. And then they'll often do some sampling of the lymph nodes. Or they might talk to you about a mastectomy, where they take the entire breast off. Sometimes they do both, as I had mentioned earlier, but those are generally the two options and that you can have. And then, of course, if you have the mastectomy, please do ask about reconstruction options. So sometimes we forget about that. Reconstruction is essentially where you would meet with a plastic surgeon and discuss the options for recreating the a structure and similar to the breast that was removed. Sometimes they'll even do a lift on the other side just to balance things out. Sometimes they'll take the tissue from the abdomen or from the back and move it up to the chest to form a breast mound. Other times they'll put in a implant. And so they have different options for the reconstruction approach. So if your surgeon is recommending a mastectomy, or if you choose a mastectomy, be sure to ask about the reconstruction options as well. You don't have to do reconstruction. My mom didn't. She was just like, take them off. I don't want to think about them anymore. I don't want to go through the stress of a mammogram, and that's perfectly fine as well. And then some people are gonna, that's gonna be really important to them is reconstruction. So I just want to encourage you to ask those questions. The radiation doctor is going to do the external beams directly to the breast and or lymph node area. So again, this is a very localized treatment, and it's to help eradicate any remaining cancer cells that might be present. And then, of course, I had mentioned the medicines, and there's now a lot of different options. Back in the day, we just called everything chemotherapy, and sometimes patients still do. But your medical oncologist is going to talk to you about whether they think chemotherapy is the right option. And chemotherapy tends to be more indiscriminate, and can affect both cancer cells and healthy cells. Um, but you can also be considered for targeted therapy. So remember how I mentioned that we would look for genetic mutations? So one of the medicines that can be used for patients who have certain genetic mutations is a targeted therapy. We also consider immunotherapy. Keytruda has been doing a ton of advertisements. I don't know if either of you guys had seen those, but Keytruda is one of the immunotherapies, and so sometimes for certain patients we do use immunotherapy, and a lot of times we'll combine that with chemotherapy to really give kind of a 1 + 1 is 3, really accentuate the benefit to both of those. And then
I've
finally,
never heard
many
of
patients.
any of these.
What's that?
I've never heard of any of these
You've never heard of
besides
any of those?
chemo and radiation. That's
That's okay. That's okay. Your medical oncologist will talk to you kind of about what the right thing is for you. It's going to be based upon the stage and those receptors to really know what's the right step. And then finally, there's the endocrine therapy or hormone blocking treatment, and that's specifically for patients who have a hormone positive breast cancer. So there's a lot of different options, but your medical oncologist will work through and talk to you about which ones are right for you.
And so, Janae, I had a mastectomy, and I would say if depending on what you decide to do, you have to. This is one of the things that my plastic surgeon actually said to me. You have to make the decision that you can live with, because it is life altering. So some women that you've seen, we see them go flat, but there's some adjustment phases as well. So you really have to make that decision when it comes to plastic surgery based on your lifestyle. And for me, I had chemotherapy. I had 6 rounds of chemotherapy over 3 months. I did not need radiation. But Dr. Unger, what is the difference between chemotherapy, radiation, immunotherapy, and targeted therapy?
Yep, it goes back to either where the treatment is being provided, as in, is it going to the whole body? So any of the medicines, any of the chemotherapy, hormone blocking treatments, pills, IV treatments, that's going to go through the whole body, head to toe. Whereas treatments like radiation is specifically to that part of the body of the breast and or lymph node area. And so it has to do with kind of where those treatments are really targeting. But there's a lot, and even as as cancer care advances, thankfully there's way more options than back, when my mom was treated. And so we have a lot more options, and improved tolerance for really all of these treatments.
so I will say, just from working with my sister's keeper, um, we see that several women may have the same type of cancer, but different treatment plans.
Mhm.
Why is that?
I get this question very often. And really, it's because breast cancer is common. Breast cancer is going to affect 1 in 8 women. I mean, most of us know somebody who has been impacted by breast cancer. And so there can sometimes be a little bit of comparison, like, okay, why did she get that? And how come I'm not getting offered that? I get this question a lot actually with immunotherapy. And so I let people know that your treatment care, or rather your plan of care has been recommended to you based upon your stage, as well as your biomarkers. but also because of your own personal health. So, if somebody comes into my office and they are a 44-year-old person with very few medical problems, um, we might offer what we would call the gold standard, the very most effective treatment, even if it is the most rigorous. So I might tell them like, hey, this treatment is going to be tough. We're gonna help you get through it. And it's to help us achieve the very important goal of being cancer free in the future. Whereas if I have maybe an 87-year-old woman come in with heart disease and heart failure and on oxygen, we might take a more conservative approach, a more gentle approach. And that's because we're really considering what her overall health is. But I also consider what the patient's values are. If someone tells me that they have a, philosophical belief that they should not take chemotherapy, for example, we'll talk about what the pros and cons are of that decision. I will always provide them a recommendation. Your doctor should always be providing you a recommendation. That is literally what you are paying them for, is a recommendation, but also to explain why that's their recommendation. And so you want them to hear that they're taking in consideration your specific reports, the information, your health, to help make that recommendation in addition to your own values. Sometimes we are limited by even where that person's getting care from. In the Cleveland area, we're going to have access to pretty much everything, where in some more rural communities they might not have access to as many different options, especially as it pertains to maybe reconstruction options or even some of the radiation treatment options. um, you also might get a doctor who may or may not treat your cancer all the time. I always encourage folks to ask their doctor, like, hey, how many times a week do you see a patient like me? As a academic oncologist, I see breast cancer all day, every day. And so something I'm very comfortable with. And I feel very fortunate to be able to focus on just breast cancer because the treatments change incredibly quickly. I mean, even within this past month, we recently had a big meeting and there were some practice changing updates. And so patients might be treated a little bit differently this month than they might have last month simply because of those new updates. And then finally, we can't deny that there is sometimes bias. And so that's why I really want you to be armed with information, armed with an advocate to help you ask the questions, to make sure that the plan that's being recommended to you is really the best plan for you.
So how will we measure progress? Like how do I even know the treatment will work or is working?
The treatments are going to be based upon the information from your pathology. And so clinical trials help to guide what those treatments are. And then for someone who has a larger tumor that maybe needs to receive medicines first and then go to surgery, the doctor is going to be examining your breast as you're getting treatment to make sure that it's shrinking down, that the cancer is shrinking down. If it starts to go in the wrong direction, if you start to get more pain, or if there's redness, or something is changing in a way that doesn't feel like it's getting smaller and softer, your doctor might talk to you about skipping ahead to surgery first. Sometimes we'll also use scans. Sometimes it's ultrasound or mammogram, or PET scans or CAT scans to help us monitor what is happening on the inside of the body, particularly if there's times where we can't just feel it on the physical examination. Sometimes we can feel it on physical exam, sometimes we can't, but those pictures can help us keep tabs on how things are responding to make sure that we're on the right track.
So who's all like on my care team?
Yep. So that's going to be when you think about the care team, especially if you're getting treatment up front, and once you go to your appointment, you'll be able um, to get a little bit more information. But when you're getting treatment, as in the medicines up front, your medical oncologist is going to be kind of leading the way. And so the way I explain it to my patients is often I'm like, hey, I'm going to be driving in the bus in the beginning. You're right next to me riding shotgun. And then the radiation oncologist and the surgeon are in the back, and they're kind of waiting until we get to our destination. And then other times, if we're going to do surgery first, the surgeon's driving. You're riding shotgun, and then I'm in the back, and I'm waiting until we get to after surgery, where we get to have that conversation about kind of what the next steps are. Um, a lot of times you will have a nurse who's working closely with your doctor. And so a lot of times that'll be the person who might respond to, if your healthcare organization uses my chart, if it's my chart messages or even phone calls, there usually will be a nurse that you'll be having more regular conversation with because your doctor's usually in clinic seeing patients, but they're often, getting updates from the nurse just to make sure that everything is going according to plan. And the nurse will help with even things like FMLA paperwork, disability. They can connect you with a social worker. They have a lot of resources. So while the doctors are helping orchestrate the care, there might be a nurse who's helping coordinate that care, making sure that you get, scans scheduled at the right time and your treatment scheduled at the right time, your surgery scheduled at the right time, that kind of thing.
And let's not forget, you need support, Jay. So, in addition to the medical treatment aspects of your care, that's very important. But there's another element that you must pay attention to as well, which is yourself. Get involved with some support groups in the community. There's My Sister's Keeper. We're always here for you. There's the Gathering Place. There's the American Cancer Society. There's Pink Halos. There's so many support groups across Cleveland, and they're all great. We're part of My Sister's Keeper. My Sister's Keeper is great, yes, but there's more. We only may cover one half, but you need as much support around you to help you to not lose yourself. Some of the things that we may say within the organization is that you get lost. Sometimes you feel like an alien or an outsider. These support groups are very important to help you to maintain that sanity and just continue to see that bright light ahead. So definitely, community support, nutritionists, um, massages is good. Sometimes you need to do that as well.
I'll take that.
Acupuncture. You like that one. But just remember, take care of you. The doctor, the oncology team, your cancer team or your care team is taking care of you from the inside. You also have to take care of yourself holistically, mentally, and emotionally. So be sure to tap into those services, and it's never too late, too early to even start to look.
And you can even ask your doctor for a prescription. And sometimes your insurance might defray some of the cost, or it'll be at a lower cost. Or if you have a prescription, whoever you're going through might give you a lower cost. Like I've even had patients who were able to get a lower cost gym membership. Once they were diagnosed with breast cancer, all they needed was a letter from me to say that they were diagnosed with breast cancer and are undergoing care, and they were able to get that low cost or free because they wanted them to be able to continue to take the very best care, of themselves. So don't hesitate to reach out and ask about that. And even as we're thinking about, some of these other supportive aspects, sometimes people are worried about, the potential side effects for all these different treatments that you might hear about when you go to your appointment. And so sometimes people can, really worry about the side effects for that. Sherry, when you went through your treatment, was that something that you thought about? Did you have any side effects from your treatment?
Oh yeah, I had plenty of side effects, and it's kind of funny. And Janae, your doctors probably more than likely will do this too. They'll give you some handouts, some paperwork that will tell you all the side effects based on the cocktail. Should you need chemo, that it will handle. So some of the most common was fatigue, headaches, joint pain, nausea. If you're going through chemo, definitely you have like a metallic taste in your mouth that just doesn't go away and everything just doesn't taste right. So you have loss of appetite, um, hair loss. It's so many different side effects and also the hormonal aspects as well. You maybe have those hot flashes. And so yeah, that seems like a lot, isn't it? Uh, but you'll be okay. We'll help you through it.
And so some of the common side effects, I'm really glad that you mentioned even like the taste, because I think that's can be something that we sometimes forget about. And what I've recently started telling my patients is, if we're going to be doing chemotherapy, um, even just having ice in your mouth can actually help reduce some of the taste changes. That is something that is totally free, does not hurt anything, but it can reduce some of those taste changes, and the taste changes can be really bothersome. Some of the side effects that your doctor will probably ask you about at your treatments are going to be probably about, we call it neuropathy or numbness and tingling that can happen in the fingers or even in the toes. They might ask you about the fatigue. Are you able to kind of get through most of the day, or do you find that you're sleeping 18 hours a day? Because if it's really laying you out that bad, your doctor might make an adjustment in the treatment regimen or the dose, just to help it not um, be quite as strong in terms of the side effects. But you should also talk to your doctor if you're having nausea and vomiting. Now, certainly on that list that Sherry mentioned, nausea and vomiting is going to be on there, but that doesn't mean that you should be at home suffering, vomiting 6 times a day. That is not the expectation. If you're having that side effect list, it just means like you may experience some of these, or and your doctor can let you know, hey, I generally expect that patients are going to have some of these, but not all of these, and the degree to which you get them, severe versus mild can differ from patient to patient, and different treatment plans. Your doctor will likely talk to you about different ways that they can alleviate or help some of those side effects, even with conventional medicines like anti-nausea medicines or anti-diarrheas. um, and so they might talk to you about that. But there's also other things that you might want to ask your doctor about. We call it complementary and alternative medicine. Um, and so I'm just curious, have you all here heard about complementary alternative medicine? I'm curious if others, who are listening in have heard about, are familiar with the difference between, alternative and complementary approaches to cancer care. And
Okay, and
Sherry,
I'll
you can let me know when you think I can talk a little bit about that. I want to give folks just a moment to kind of think about that.
okay. We'll give it a couple more minutes. We're kind of behind on Facebook, so it
That's
may be
okay.
delayed.
I personally haven't.
I'll be happy to tell you a little bit about it.
Okay, so we have 50%. I've never heard of these terms. 50% I've heard of them, but don't know the difference.
Okay, thank you. So yeah, I find that's actually pretty common, that people, maybe heard a little bit about it, or have some familiarity, but aren't entirely sure kind of what the difference between those are. So complementary is basically where there is evidence based to show that there is reason to believe that something can be helpful, that are outside of conventional Western medicine. So conventional Western medicine would be kind of the normal expected plan of care. Alternative medication or alternative medicine are practices or treatments used in place of conventional medicine, and are not evidence-based. So that might be someone who comes in and they might say, okay, Dr. Onger, I'm here because my daughter insisted, but this is going to be our only appointment. I am treating my cancer with alternative medicine. I'm doing, you know, something else. I'm not doing any conventional treatment. And that is within any person's right. I always just try to have a conversation about the pros and cons of different options, and the pros and cons of not treating the cancer, and also when it might be a good idea to um, have a follow-up visit if things are not going as one might hope. Even if my patient initially chooses alternative medicine, I'm still happy to see them back later if they decide that they want to reconsider, um, conventional medicine. And you really do want a doctor who's going to be open-minded and be willing to have a conversation with you about different options. Integrative medicine is something that I encourage my patients to participate in, because that really combines the appropriate therapies and treatments from conventional medicine, and complementary medicine in a really patient centered and evidence-informed fashion. And in a space where we're really thinking about how cancer care and cancer treatment can sometimes have a big impact not only on your physical appearance, on your kind of mental wellness, but just real talk, it can affect your finances. My Unfortunately, my family had a lot of experience with cancer, and my cousin lost her job when she was dealing with her stage 3 cancer, and so there were a lot of things that she had to really think carefully about as she was going through treatment. And thankfully, we were able to get her, state care, and she was able to get her treatments covered, and she was able to kind of go through that as expected. But she didn't have her job's insurance anymore as she was going through that treatment. So whenever I talk to patients and they're asking, will this herb help? Will this thing help? Will this medicine or this vitamin help? I'm going to recommend things that do have evidence to them because I don't want them spending money on things that don't show benefit. Because I don't want it to be a waste of their time, a waste of their money. And we also have to consider if things can interact. Just because you can buy it over the counter or you can buy it without a prescription doesn't mean it's safe, because certainly there can be interactions between different treatments, even chemotherapy and um, herbs or supplements.
That's that. I'm 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 speechless myself. I'm learning a lot from you, Dr. Unger. Thank you so very much. I do have a question, and maybe this will help Janae too, as she carries her journey. In terms of um, you mentioned like your sister was didn't have to work. What place or what role can a social worker do to help her? With just the aspects of life, financial loss, things of that nature. What are some resources to that aspect? And in addition to other resources that you would recommend would be a good point for her.
Absolutely. So I do refer a lot of my patients to the social workers. So our social workers have a habit of screening patients ahead of time for any potential social determinants of health that might impact their ability to remain in care. So that could be something like substance abuse. I do have some patients who struggle with heroin or cocaine, and they still need their chemotherapy. They still need treatment, and so our social worker helps connect them with resources to be able to um, adhere to care while they're dealing with their substance use. Sometimes it's housing insecurity, and so I might have a social worker who has helped get people into housing, either if it's just like a financial situation or even if there's a domestic safety issue. They can help get you into a safer space. And there's, again, a lot of community resources, but sometimes that social worker can be kind of the point person to help direct you towards those other social services. Uh, in terms when it comes to actual kind of the medicine referrals, I have a pharmacist who I work closely with. So sometimes the patient will send me a bottle of something and say, hey, there's 15 different supplements, and here, is this safe for me to take? And as you might imagine, there are maybe hundreds or thousands of different supplements that one could consider. So that's something that I would want my patient to really, talk to me about. Um, and so I'll have our pharmacist review it with them, and then we can determine if that's something that should be a part of their care or not. But I also will refer to a couple of websites like this About Herbs website. This is by the Memorial Sloan Kettering Cancer Center, and they have a lot of really helpful and accurate information about some of the supplements that people might be interested in. You can also go to the Division for Cancer Treatment and Diagnosis Office of Complementary Cancer Care, and that's through the NIH, to get information about alternative therapies. There can be a lot of questions about like high dose vitamin C, for example, and so this is another great place to go for information. And as you can imagine, there's also been a lot of discussion about cannabis, and if that's helpful. Currently, my organization, the Cleveland Clinic, doesn't support cannabis use, just because there hasn't been enough data to tell us that we know that it's safe. but there are ongoing discussions about that. And then finally, you can also go to the National Center for Complementary and Integrative Health websites. And so this is really about arming yourself with accurate information. There are going to be many websites that want you to pay cash or go to Mexico for this treatment, and everybody is going to want to take your money. I'm just putting it out there. But these are some of the websites that you can really go to be able to make an informed decision about yourself, how you spend your time, how you spend your money. So overall, I really encourage my patients to like talk with their doctor, talk with the pharmacist. I mentioned that I work with integrative medicine, even your palliative medicine doctor, as you're making determinations about what additional things you might want to add into your care. And then do remember, just because it's natural doesn't mean it's safe. And just because you can buy it, doesn't mean it's effective. And ask questions. Ask questions to your medical team, but also ask questions to, if somebody wants you to do treatments in Mexico or they want you to put a salve on, ask questions. Are there clinical trials for patients with my stage and type of cancer that has shown this is helpful? Because it's going to be $2,000. So ask questions.
Well, Janae, I know it's heavy right now, but I wanted to make sure you had all or was fully equipped as you take your first step to this journey. So I have a bunch of more people I got lined up for you in the next couple of weeks that I want you to speak with, just to better equip you. But how are you feeling? How do you feel right now?
Um, Still a bit overwhelmed, but I feel like at least I have some of the tools equipped to get through this journey. And I definitely don't feel as alone because I know I have you ladies there to walk with me along the way.
Absolutely.
Sounds good. And Dr. Unger, would it be okay for some of our sisters that are on the line or on Facebook, if they have any questions, they can pose some questions to us?
Absolutely.
All right, so Janae, we can cut.
All right.
Thank you for that great.
I'm a mess.
Oh,
Great.
yes, indeed. So anyone that is online with us or anyone on Facebook, if you have any questions that you may want to ask, please, we encourage you to ask those questions. The goal of this program is to help you to understand the path of cancer. You don't know what you don't know until you know you need to know it, and then by that time you was forced to know it. So this is our goal, to kind of equip you, know what to expect, what questions you can or should ask. One point, actually, Dr. Unger, if you don't mind, second opinions. How valuable would you recommend second opinions? What would how do you feel about second opinions?
Oh, I am so glad that you asked this question. I encourage my patients to get second opinions. And I think that any doctor who has your best interest at heart will be very comfortable with a second opinion. The reason I'm comfortable with second opinions is because I base my recommendations based upon what the current standard of care is. I will print out the NCCN guidelines. So that's the National Comprehensive Cancer Network. That is a place that shows what the recommended treatments are for a particular type of cancer. I want to say there's probably like 27 different cancers, and they include what the current guidelines are for those different types of cancers. And so I will print that out and I'll say, I encourage you to get a second opinion. I'll say this, I am recommending that we adhere to the gold standard, because it is shown to be the most effective route. And if somebody is recommending something less than this, I encourage you to ask them why. There might be a very valid reason why, but you want to make sure that you understand why. But I also, and again, the NCCN, the National Comprehensive Cancer Network, they have a side for physicians, so it's very technical, but they also have a patient-facing side. And so when you're navigating that, if you're just kind of getting started, it might be helpful to go to the patient center side. But I'll also go to the American Cancer Society website and we'll print out information from our patients. Clinicaltrials.gov can be an excellent place when somebody's looking for different clinical trial options, and then cancer.gov for information from the National Cancer Institute. So overall, I feel very comfortable with second opinions, and I encourage my patients, if there's any question at all, we can always present to tumor board, but that's going to be still within our same organization. Feel free to get a second opinion. We don't want to hem and haw for 3 months now, but feel free to get a second opinion.
Thank you. Miss Lydia, you have a question?
Yes, I do. Dr. Onger, my mother was diagnosed with breast cancer in 2007, and then the second time in 2024. Now, I was 35 years old when my mother was initially diagnosed with breast cancer. However, I did not get a mammogram till I was 40. I do have a daughter who is 30 years old at this time. What would you recommend she should get a breast exam?
So the time of the screening mammogram, and again, screening means you have no symptoms whatsoever. So provided that your daughter doesn't have any symptoms, then the latest she should wait is age 40. If she has any symptoms, then she should get a diagnostic. She should call a doctor, get a diagnostic mammogram, in a short amount of time. And then if there can be different things, so the most important is going to be that first degree relative. So that's going to be mom and dad, for your daughter. So that'll be you and her father. Um, whatever if you guys have any cancers, that's going to be the most informative information for her. A grandmother is going to be further removed from her, and so that would not necessarily automatically mean that she qualifies for early screening, but a medical breast consultation, or even sometimes the primary care doctors can offer some additional risk assessments based upon, as we mentioned, family history, but also if she's had breast biopsies in the past, that can help influence whether she qualifies for earlier screening, or even preventative treatments. So it's going to be a little bit nuanced, but if it's a first degree relative, so again, if it's like a mother, we generally say 10 years before that diagnosis. But if it's a grandmother, because it's going to be a little bit further away, then we'll have to consider if there's other risk factors that she would need to get screened earlier.
Thank you.
You're welcome.
Does anyone else have any additional questions?
I do actually. I've heard often that some breast cancers are like estrogen fed or something like that. Can you explain what that means?
Absolutely, yes. I didn't get too far into the kind of nitty gritty about the receptors, just for the sake of time today, but I'm so glad that you asked about it, because this is a really important aspect to understand. So about 80% of breast cancers are going to be driven by the hormones. The way I informally think about it is, what's feeding the cancer? Is it the hormones in the body, or is it hormones or not? 80% are going to be hormone driven. So we call that hormone receptor positive, where the estrogen and or progesterone receptor on the cancer cell is active. The receptor I think about as a switch. And so I think that switch is turned on, the cancer is active in the presence of estrogen. Now,
Mm.
many postmenopausal women, so women who are no longer having menses, their ovaries are no longer making estrogen, many postmenopausal women will still get a hormone positive breast cancer. And that's because our fat cells will make estrogen, which is why that postmenopausal weight gain can be important.
Oh,
And then your adrenal glands also make estrogen. So the fat cells and the adrenal glands will continue to make estrogen throughout your entire life, including in the postmenopausal years. It's low amounts of estrogen, but it's enough to feed a cancer cell.
wow. Thank
So
you.
when you're welcome. So that's why that, as we're talking about treatment options, if the pathology report shows it's hormone sensitive, often at some point in the cancer treatment plan, we'll talk about blocking the estrogen so that it doesn't feed the cancer further.
And when you say blocking, that means pushing you towards menopause?
So Essentially, yes. Because the menopause is essentially a transition where your body goes through from a high estrogen state to a lower estrogen state. And so sometimes that happens naturally just as we age. Sometimes it happens more abruptly with the medications that we need to treat a cancer. But it essentially can put you into a menopause state. Sometimes it's permanent, sometimes it's not. And it just depends upon that person's age and the medicines that are used in that state, and also the patient's goals. Sometimes they say, well, I'd rather just get the ovaries out. I'm not interested in children in the future. Whereas if it's a 20-year-old woman, and unfortunately, I do have patients who are in their 20s in my practice, they might be interested in having children later on. So what I tell them is that we're going to go ahead and we're going to take care of the cancer right now. And while we might need to be on hormone blocking treatments for maybe 5 or 10 years, we get usually I'm able to tell the patient at least after the first 2 years, then we can kind of take a little break if you want to have your children breastfeed, and then we'll kind of pick back up with the hormone blocking treatment.
Wow.
So it's not off the table, completely, but it is a very individualized conversation.
Good information. Thank you. Thank you.
You're welcome.
Well, Dr. Unger, thank you so much for your time. Thank you for spending your Sunday with us, an hour of your day. Next time, I know it's high risk, but have a glass of wine with us.
Then I choose it for high value moments like this.
Yes.
It was an honor to be invited, truthfully. This is exactly what it's about, is us talking to our community and our friends and family about, what we can do to be healthier in the future. So when you asked me, I was so honored to be able to be a part of this, and I just could not stop without sharing my mom's picture as well. This is her speaking at the Black Women's Wellness Foundation, which is an organization that she helped found in Madison, Wisconsin. So this is my mom right here. This is their CEO. And they basically formed this organization because many of the women knew other women that had died just too young. And they really wanted to have a community organization that was focused on the wellness of Black women in Wisconsin in particular. So I just feel like I am continuing my mother's legacy while she is still alive, which is a wonderful blessing. So thank you so much for the opportunity to join you all with your wonderful organization. I hope we can continue to stay in touch in the future as well.
Oh, definitely. You have a new set of sisters for life. So yes, be
Oh,
prepared.
thank you. Thank you.
Dr. Unger, for anyone that's watching that will love, unfortunately may have the diagnosis of cancer, but is looking for another provider, how can they get in touch with you?
Yeah, so if they reach out to the Cleveland Clinic Cancer Answer line, and you can just Google it, or if you just call the Cleveland Clinic number and just say, hey, I need an appointment with Dr. Onger, I was diagnosed, or I want a second opinion about my care, or I just want to make sure I'm on the right path. I would be happy to see any patient, and the Cancer Answer line is really great, even though the schedules book up. If there's somebody who reaches out and is like, hey, I really want to see Dr. Onger, like, I will get you in. So please don't hesitate to reach out. I'd be happy to, look over anyone's course. My office will get all your records. You don't have to worry about that. You just call and you say, hey, I need an appointment. This is where I was diagnosed, and they will get everything else.
Well, thank you so much. Thank you again, Dr. Unger. I'm so happy that we have crossed your path. We will be working together soon in the future because you are just a wealth of knowledge. I love your perspective. I love your heart. And you have the experience that many of us that we call ourselves warriors want. How can you tell me what it's like to have cancer if you never had it or never experienced it in your life? You may treat it, but having it and experiencing it is different. So thank you for spending your time with us and just sharing your heart with us. So till next week, we'll see you our next round. We're either doing image and relationship or financial. We're working on the schedule, but we will post it on Facebook. Janae, thank you so much for that wonderful performance. For those of you who have joined us online, thank you for joining us. Those of us in the room, thank you for joining us as well. But Janae, before we go, I will let you close us out. I didn't know if you want to put scene up again.
So thank you all. This has been a very, very great conversation. It's been real. I'm all in my feels right now. But I hope it gave you a little clarity and a whole lot of support. So again, this is the first of many sessions in this series. We'll see you at the next one. So our promise is to keep it real, keep it tender, and keep showing up for one another. So thank you all again for being here tonight. Thank you for being brave. And thank you for being a part of this sisterhood. We got you.